Hey, my name is Dr. Sean Price, Clinical Coordinator here at The Fix in Fort Walton Beach. And today I want to talk about back braces. You know, the kind that you put around your waist and then you can kind of use the neoprene and they give you back support. And I know that a lot of places like some of our wholesale clubs, sometimes grocery stores, retail stores, places that require a lot of lifting will have their employees wearing these. And I know a lot of patients ask about them whenever they're suffering from low back pain. And they can be helpful, and they can be something that can provide you with relief and actually help you prevent injuries. But you have to use them properly, because if you overuse them, just like anything else in life, you can actually cause more harm than good. So one of the challenges when you're using one of these back braces is if you use it too long, the muscles that actually strengthen the core will start to atrophy, because the brace will be doing the work, so the muscle will not have to work so hard. And in the body, if you don't use it, you lose it. Just like with your thyroid gland, once you start taking thyroid hormones, the thyroid is not having to produce those hormones anymore, so the thyroid will atrophy. Same thing with the pancreas and diabetes once you start taking insulin, and so on and so forth. So when you put this back brace on, the core muscles, the abdominal muscles, the paraspinals in the back, those muscles don't have to work as hard, so they start to get weaker. So if you wear it all the time and if you use it constantly, you can actually atrophy those muscles, make your spine weaker, and predispose yourself to injury. So it's very important that when you're using these, you use them appropriately. Now, everybody's situation is different, so these are just general rules that I'm giving. They are not specific for all situations. For example, somebody who just came out of back surgery or somebody who is actively involved in non-surgical spinal decompression may need to wear a back brace a little bit more consistently in the beginning, because they have a healing process and they need that support. But you know, they need to be coached appropriately. So if you have specific questions to your situation, you may want to give us a call at the office and come in and let us give you a consultation with regards to that. But in general, they're more used for short-term relief. So for example, let's say you have a back injury and you have to go to work. Well, you could probably wear it for a week or two fairly consistently without causing too much muscle atrophy. But that's the thing that we're concerned about, is we're concerned about taking the responsibility for core stabilization away from the muscle, and then you end up with that muscle atrophy, which predisposes you to injury. So ideally, you want to use them only for the short term. Now, in some situations for patients who, so for example, that might work at one of these places where they require heavy lifting and things along those lines, well, in that situation, it's good to have it so that when you go to do a lifting protocol, you go to lift something heavy, you can tighten it up and use it for support, but then immediately undo it when you're just back to normal day-to-day activity. It's a good thing to have for support. You see power lifters that'll use these to support their spine when they're lifting heavy weights. That's absolutely fine if you need it for a given activity. But when you get down to the day-to-day postural activity, you want that to be undone. So a lot of these places that people work, they have the shoulder straps that go on these braces, and that's great because then you loosen it up, the spine's doing what it's supposed to be doing, the core muscles are doing what they're supposed to be doing, but then when you go to lift something heavy, you tighten it up, you do the activity, and you loosen it back up. So that's a good, appropriate, long-term use of a back support. And whether you have the back support on or not, always use proper lifting form. Don't let the back support get you in a situation where you're getting sloppy with your form and your mechanics, because you can still cause damage and still injure yourself. So these are the basic rules that you want to follow with this. Again, if you have any questions or you need specific guidance, or if you have a unique situation, you're just recovering from back surgery, or you have an acute injury, or you're going through physical therapy, any of these things, please feel free to give us a call. We'll be happy to consult with you on the best way to utilize a back support. All right, have a great day. If you'd like to subscribe to the YouTube channel, that way you can get more and more of these daily videos, and let us know if you have any questions.